Cool.
Starting now.
All right. 5 o'clock Pacific, 6 Mountain, 7 Central, 8 Eastern. I know we got a lot of folks hopping on here, so we'll give them a few minutes, or maybe a minute or two. Dr. Manning, since you are in Arizona, you are the mystical unicorn for time changes or lack thereof. What time is it actually in your neck of the woods here?
It is 6 o'clock because during this time of the year, we like to play Mountain Time. And during the summer, we play Pacific Time. Why? Because we don't move.
Well, yeah, there's that. We could call you stubborn as well, but you know, the rest of us, you know, have to deal with this movement on a regular basis. Well, hey guys, it looks like we've got quite a few folks on. We want to respect your time and thank you all for being here. We're going to hang out for about an hour this evening, and hopefully you guys enjoyed the time. I am Michael Cohen, CEO, founder of Awaken to Sleep. We are co-hosting this event tonight with SomnoMed. SomnoMed is a medical device manufacturer of oral appliance therapy. So we thank them for their support and sponsorship tonight. Just a couple of housekeeping items. We are going to do this as interactive as humanly possible, even though we're all just on a screen. We've got Dr. Manning here, who I'll introduce in just a moment. But we've got a couple of features here. We've got the Q&A section. If you guys have questions, we would absolutely like to hear from you. So please utilize that. As you think of the question, type it in. We'll try to answer as many as we can live tonight. If you would please reserve the chat feature for answering any of the questions that we pose in the webinar. So if you guys are listening to Dr. Manning, we're going to use that for part of your participation. So if you would answer his questions there, and then go ahead and ask your questions in the Q&A, we'll be getting to as many of those as we possibly can. So one more disclaimer here. Awaken to Sleep is a for-profit company, as well as SomnoMed. We are sponsoring this CE event together tonight. And we've got Dr. Greg Manning here, who is a good friend, but also a cucumber farmer turned dentist in Arizona. I love introducing you that way. But Dr. Manning is experienced dental sleep medicine dentist and general dentist in Gilbert, Arizona. He's a wealth of knowledge. And yeah, guys, we're going to have some fun. As far as the CE portion tonight, we are awarding 1 CE through AGD PACE. So you're going to have to fill out a questionnaire survey afterwards. We'll go ahead and put that in the chat box for those of you to click on and fill out at the end. So yeah, sit back, enjoy. Please type those questions into the Q&A. And Dr. Manning, take it away, man.
Okay, I'm up. I'm winning. Doesn't everybody love after work CE? My goodness, nothing like putting in a good hard days of work and then sitting in front of a computer and listening to some schmo from Arizona talk for the next 45 minutes. Speaking of schmo from Arizona, I'll introduce myself a little bit so that you know that from here on out, anybody can and should be doing lots of dental sleep medicine in their practice. We'll get to a couple of numbers as to why that happened, but a little bit about the journey that is Greg Manning's journey to becoming, and the regular drill and fill, we still got a good hygiene thing going on. And, you know, we like to do bridges and we like to do crowns and implants, and we still hate to do fillings like every other dentist. But, you know, we did a startup from scratch, this practice about 11 years ago, which was a little over 11 years ago, 2009. And if we all remember 2009, not exactly the greatest time to be like jumping into the deep end of business ventures as the economy was down and things were not going well. So it kind of gives you a little insight into how smart I am. But we did a startup in 2009, and I definitely had much more time than I had money. So a friend of mine from Washington State said, "Hey, I'm coming down to do a sleep apnea CE and it's in Phoenix. You should come with me." And I went more for the company than I did for the sleep apnea, but somehow I found myself on a list of people that had been to this course, and somebody sought me out some months later after I'd taken this course. I basically did the appliance for him, which was a SomnoMed Classic. And I did it at cost because I told him I didn't know what I was doing. And he walked me through what he'd done because he'd already had an appliance before. And so he showed me what he had done before, and we kind of walked through it. It was kind of embarrassing, but at the end of the day, he got an appliance that worked from one that had broken. And so started the journey. It so happened that he owned a transportation company, and he had a lot of people that were truckers that, in essence, needed to sleep, and a lot of them couldn't use CPAP machines. And so with a lot of them needing to sleep, they ended up needing oral appliances, and he sent a lot of people. And so we began. And truthfully, had that not happened, I probably never would have ever become a dentist that did sleep medicine. So at the end of the day, I guess I owe it to him that it kind of got off the ground. But back then, 11, 12 years ago, there were not as many resources in dental sleep medicine as there are today. And a couple of the resources that you've been introduced to today are SomnoMed and Awaken to Sleep. And we're going to talk after the CE portion, there'll be some offers and things, and we can talk a little bit about how they can help you on your journey. But in essence, we hacked through the forest with a machete. We tried to figure stuff out. We even tried to figure out medical billing on these kind of things before that was super hot. And we did an okay job. We figured a few things out, but the road was long and hard, and the hack through the forest was very difficult. Now there's a paved highway to success right through that forest. And hopefully tonight will help a little bit with that. But there's definitely some more deep dive courses that we can talk about taking that will really help us incorporate sleep into our practice. So let's get going here. I'm embarrassed to admit as I put this first slide up, because really I don't necessarily feel like everybody's going to need this slide. In fact, I'm guessing most won't. But I told you that I went to this first CE thing with a friend of mine, and I didn't really care much about it. I just went because we hadn't seen each other from dental school in a few years. And so it was actually a couple of different sleep medicine courses before I really got a handle on these 2-3 terms and really knew exactly what they were and how to talk to patients about that. But in essence, we're going to talk about 2 dangerous things that happen when we sleep. The first dangerous thing is apnea. Apnea is basically when we stop breathing for 10 seconds or longer. This slide says, for the technical folks out there, reduction in airflow of 90% for 10 seconds or longer. A reduction in airflow of 90% is either going to look like a complete stoppage or it's going to be a complete stoppage. And so that is where you'll have patients or their spouses saying, "Hey, my wife or my husband says I stop breathing." That's an apnea. And it will almost always, because of the amount of reduction of airflow for that 10 seconds, it's almost always going to have a reduction in blood oxygen saturation. Now, apnea has kind of an annoying little brother called hypopnea, and hypopnea is in essence the reduction of airflow of 30% or more for 10 seconds, but also has this associated drop in blood oxygen. So as our blood oxygen drops, we start to have other problems. And tonight is not the night that we're talking about these other problems or what these things mean to our patients. But I wanted to just kind of set a little precedence about apnea and hypopnea, because these are the 2 dangers that we have while we're sleeping, is 2 things that can cause us to not become oxygenated. Now, how many times these things happen to us per hour of sleep is called the apnea hypopnea index, or the AHI. And the apnea hypopnea index is in essence our number, how many times is this happening per hour, but it's also how we use to diagnose these kind of things. You'll see these people come in and they'll say, "Oh, I'm bad. I'm really bad." And you'll say, "What was your number?" "I don't know, but my doctor said I was bad." And so we want to be able to really clearly define what real bad is, because sometimes they'll come in and any apnea is bad, but is it real bad? Is it mild? Is it moderate? Is it severe? So when we talk about the severity level, without belaboring this point too long because we've got a lot to get to in appliance selection today. A normal AHI is going to be anything less than 5 events per hour, apneas or hypopneas, as long as we're keeping a decent blood oxygen saturation. Now, to move through this slide quickly, the parameters for mild are 5 to 15 events per hour. So as long as we're keeping 5 to 15, we'll call that mild apnea. Moderate apnea, we're going to call that 15 to 30, and then anything over 30 is severe. So if a patient comes in and says, oh, I'm real bad, and we happen to get a copy of their sleep study and they're at a 24, yeah, I mean, that's not great. We don't love 24, but really they're moderate. And we're going to talk about what that means to us as sleep dentists in a little bit. Now, if somebody comes in and they're like, yeah, I'm 84. Yeah, they're super severe. That's the really bad. That's really, really, really bad. And we'll talk about what that means for the way we treat those patients as we move forward in this as well. So I just want us to remember, if we're new to sleep medicine, mild is 5 to 15, moderate is 15 to 30, and severe is anything over 30. For those that have been in sleep medicine forever, thanks for bearing with us. Moving on. When we talk about sleep as dentists, one of the things that we're awesome at is being awesome. And because we're so awesome, people want to come see us twice a year at minimum. So we end up seeing the world's population a lot more than they're going to see, say, their pulmonologist or their ear, nose, and throat doctor or their cardiologist. And so often we're going to see these patients and we're going to see the area where some of this apnea is getting started, sort of the hot zone for apnea, which is kind of airway area. And so we have the ability to start identifying these patients as dentists. I mean, most patients or most dentists have a fairly decent practice where they're seeing a handful of hygiene patients a day. Maybe they're seeing a ton of hygiene patients a day. All of these people are potential future sleep patients in our practice. The problem is they don't know it. They don't know what some of the things that are happening to them are and where they're coming from. So many of these things that they have are coming from sleep apnea, and they don't know it. If we look at this graphic, it says that there's 30 million people that are suffering, and we purposely use the word suffering because OSA hurts people. This is something that really bothers them. But they don't know that it's the sleep apnea that's bothering them because nobody's ever talked to them about it, which is why out of that 30 million, only 3 million have been diagnosed. So you think about, there's 27 million people running around that have never been diagnosed with sleep apnea, but they're hurting because they have sleep apnea. Now, that out of that 3 million people, less than 1 million, less than a third of those people are being adequately treated for sleep apnea because of the treatment modalities. Which kind of brings us to a slide when we talk about treatment modalities, and we're trying to bridge this gap between the fact that there's 30 million people that are hurting and suffering and less than 1 million are actually doing okay as a result. So when we talk about treatment options for these patients that are hurting, there's 30 million people that need a treatment option. There's really 4 paths that they can go down. One of them is they can do some sort of surgery, whether it's a orthognathic to try to extend the airway with the lower jaw, maybe open up the palate. There's also surgeries like a UPPP, which is a removal of the uvula and palatal pharyngeal tonsils and things like that to kind of open up the airway. So there is a surgical route for some of these people. Sort of the gold standard and what we hear most about sort of in the world is the CPAP. CPAP stands for continuous positive air pressure. That's the mask. That's what's going to blow us up like a balloon so we can breathe through that open balloon air. Of course, tonight we're going to talk about mandibular advancement devices or oral appliances. The last thing is do nothing. Now, when we're with our patients, we really just want, as Michael from Awaken to Sleep says, the only thing we want to take off the table for them is do nothing. We absolutely don't want them to do nothing. For some patients, it's going to need to be a CPAP. And we'll talk about that in just a second. Very, 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 very few people is it going to be surgery. Surgery is becoming a little bit of a dying option in sleep, not completely dead, but it's on life support, and it just got diagnosed with COVID. So we're going to start talking then about mandibular advancement devices. Which ones are we going to use? Why are we going to use them? One nice thing about mandibular devices, as we joke, if there even is a joke about COVID. COVID has really brought this to the forefront because of the aerosolization that happens with CPAPs. These oral appliances have become really hot as a first-line therapy. In fact, we've been somewhat busier than we ever have been with oral appliances during the pandemic, which has been kind of nice because everything else has been I digress. Unless anybody wants to hear me complain for a minute, I can just pause and we can complain. Never mind. Okay. So we refer to mandibular advancement devices, or MAD. It's also referred to oral appliance therapy, OAT. Now, when I first got into this game, back in 2009, the guidelines for this through the FDA were that we could be first-line therapy. And let me define first-line therapy, because the article over here from the DSM is that we can be that first-line therapy without having to use a CPAP first, meaning that you could go straight from your diagnosis of sleep apnea to an oral appliance, and the FDA said that's good. Well, in 2015, this actually changed, and now you can be first-line therapy for your mild patients, just like we always have. But then in 2015, they also changed those guidelines to include moderate patients as first-line therapy. They finally got enough data to say, hey, man, we're doing really good with not only mild patients, but moderate patients. So we can go straight to first-line therapy. Now, unfortunately for the game of mandibular advancement devices and oral appliance therapy is that those that are severe should try CPAP as a first-line therapy. So many times we'll get that diagnosis that they're above 30. Remember, that severe is above 30. We really should recommend CPAP. Now, that being said, after the 11, 12 years that I've been doing this, so many of those patients that we refer out for CPAP because they're severe end up coming back and begging for an oral appliance because they don't tolerate that CPAP machine. While we may not be as good as the CPAP machine for these severe patients, sometimes we become the better than nothing option. And occasionally we even become as good as the CPAP might be able to get those in some of those rarer cases. So this is just to let you know that we're having a higher acceptance rate with our mandibular advancement devices than we are with CPAP, strictly because they're easier to use. The patients are starting to find out about them. The patients are starting to ask for them. You don't want to be caught with your pants down on this. You don't want to be that guy that when your patients come in and they say, do you do this? And you say, no, but I know a guy. You want to be that guy. And so let's talk about you being that guy moving forward. Oral appliance therapy is perfect for any patient that comes into your practice and they identify as a CPAP patient. You can ask them how they're doing with it. Hey, how's that CPAP going? Someone will be like, love it. My father-in-law, I mean, the guy loves his CPAP machine. He probably has a name for it. He probably feeds and waters it. I don't know. He loves that thing. So for him, I'm not going to put him in an oral appliance because A, he's severe, and B, he's doing very well with the CPAP. However, so often we'll find these patients and they say, yeah, I'm using my CPAP. How do you like it? I barely use it. Sometimes I use it a couple of times. I take it off in the night. So oral appliance therapy becomes great for those type of patients. So if you don't have somewhere in your medical history, if they've been diagnosed with sleep apnea or if they're using a CPAP machine or something like that, I would suggest maybe making a modification to that so that you can get that on there, because that's such an easy line item you can look at and identify patients that you might be able to help. We always put this on there that we make sure that we evaluate the risks for TMD in patients. However, true TMD at the joint level, and I'm not talking about neuromuscular, I'm not talking about stiff jaw joints, ligaments, that kind of tissue, is very rare that we're actually going to hurt somebody's disc or bone, in the actual TMJ and the actual joint, because the appliance is actually going to pull the disc down and forward. Pull the condyle down and forward, which actually kind of relieves that. However, it does create some tension in the muscles and the tendons. And so those are some things we'll have to, deal with as sleep dentists, but that can all be worked out in one of these bigger, deeper dive courses as to what we do during or to treat those patients that are having that type of thing. So oral appliance therapy, to take home up to this point, good for mild and moderate, good for patients that are CPAP intolerant, good. And that's why we should be doing these in our practice. one of the things really quick before we jump in here, SomnoDent and SomnoMed, being a medical device manufacturer for oral appliances, they have created their own type of gauge. And this gauge is really great because, we're going to, as we decide where to start an oral appliance, we're going to start doing it. We're going to have the oral appliance set at an initial offering for the patient. And then we can titrate that out and bring their jaw more anterior. But we kind of want to see where their range of motion is before we do that. And so we need some kind of gauge to determine the amount of range of motion that we're going to get with some of these patients. So this gauge helps to determine a nice anterior, posterior range of motion. The one thing that this does that is superior to some other gauges is that this also has this ramp that allows us to determine not only a great starting anterior posterior position for these appliances, but also a nice vertical position. And so that helps us to be able to control the height and sort of intraocclusal space of our gauges. There are some other gauges that are on the market, and the way that they control the vertical is you have to take and use different sized bite forks that go in and out of these gauges. And so you're going to end up having more inventory in these bite forks because, some of them are going to be smaller and longer. Some of them are going to have different vertical heights to them. And so with the SOM gauge, it allows the anterior, posterior, and the vertical kind of all at the same time. So great little tool for helping you determine where you want to start these oral appliances at for your patients. So all of that being said, the name of this game was 4 oral appliances we can use to treat almost any scenario. So let's jump into what these oral appliances are and, when we might use those, when I'm using them. And, I'll go back here. When I think of oral appliance now, I think of, patients that don't hate being in my office, like patients that are having extractions and implants and crowns. These are patients that love to come see me. We're helping them. They're feeling the help. They like the help. They make me feel like I'm like a really big deal. They make me feel like I'm really awesome, which I've kind of known my whole life, but didn't ever want to say. First appliance that we want to talk about. And I would say any dentist or any sleep dentist that's worth their salt at some point is going to have to jump into the world of Herbst appliances. Now, Herbst appliances, if we're looking at our bullet points, it says affordable and E0486 Medicare approved. That is a nerdy way of saying E0486 is the medical code for an oral appliance. So this medical code is if you are going to get into medical billing, and we're going to kind of breach that topic slightly at the end. But Medicare, being run by the federal government, I won't say anything else about that. They have a list of appliances that are their sort of in-network approved appliances, and Herbst is probably the best one that is out there for those patients. So if you are ever going to or currently are in network with Medicare, ups and downs, there's some pros and cons to that. I am in network with Medicare. One of the reasons why I'm in network with Medicare is because I live in Arizona, where old people come to die. And so we see a lot of Medicare patients. And so as a result, Medicare actually pays for these if you just use their sort of formulary appliance, which Herbst is. They actually cover these at almost 100% if they have a supplemental with that policy. So we end up doing a lot of Herbst just because a lot of our senior citizens that live here, that are retiring here, they're on a fixed income and they want to do what's least expensive. And this can be a good appliance for them. The one nice thing about the SomnoMed appliance, which is the SomnoMed Herbst here, is that they use this little visual calibration indicator on the side. There are other Herbst appliances made by other companies that utilize just a spinning sort of little nut on the bar. The hard part about that, if you don't have the visual calibration indicator, if you're ever getting off one side to the other, or you're not sure how much you've titrated forward, you actually have to do what's called a reset. You have to take it all the way back to 0 and then count how many times you spin that bar out. Whereas with this one, if you can follow my cursor right here, we put a little key in there and we slide it up and we slide it down and we slide it up and we slide it down to move it. And move it more and more forward on this. And it really works out nice. There's nothing worse than coming in and having a patient have a sore jaw, and it's because one of those bars has sort of like slid and the little nut has spun and you're off. With this, so quickly you can decide if that's the case and fix that. So the other thing is that they have a long range. There's a long range to titrate. So if somebody gets to a certain spot and they want to go more, this one can go more. Some appliances don't quite have the range to push somebody out. The other nice thing about these is that they have two-way. Well, I'm going to move to this next slide really quick, because these have two ways to retain them in the mouth. And I'm going to jump off of the share here, because I want to show you the two different ways. This is a Herbst appliance right here. This is the SomnoMed model, and we can see the visual indicator right here. Now this particular one uses a biflex interior, so it almost has kind of like a rubbery interior to it, sort of like our hard soft night guards that we might have made from a lab. So it's kind of a nice cushiony in there, and that tends to grab the teeth, and it's very comfortable. The other way that we can do that is we can have these ball clasps on the inside, very similar to like our flippers. If this is all hard in here, if this ever becomes loose, these ball clasps can be tightened against the teeth so that we get maximum retention in the mouth. Same with on the bottom, you can do the ball clasp retention. So as far as the Herbst goes through SomnoMed, they have two different ways to retain it. And some people like one and some people like the other. I'm getting quite hot on SomnoMed's biflex interior. It's very, very comfortable. Patients seem to just really, really like it. I'll go through my personal experience because I am sleep apneic, and I have been using an oral appliance for about 9 years, and I have had just about everything, different types of appliances in my mouth at nighttime, and I'll kind of tell you where I'm settling on. One other thing that is noteworthy before I go back to the slides is that the front of these things, we can incorporate these ball clasps in the front. One thing that's worth noting is that these ball clasps can hook these rubber bands right there so that it will help hold the mouth closed at nighttime, but still leaves, a lot of range of motion so that we don't have a lot of jaw joint stiffness. One of the reasons why I mention that is because, whether you're new to sleep or whether you've been doing sleep for a while, one of the things that needs to be reiterated is that patients will do the best if they can sleep with their mouth closed, breathing through their nose. So ideally, we want an appliance that's going to help facilitate mouth closed, breathing through the nose. And since the Herbst has these lateral bars, it does not have really any mechanical retention to hold that closed. So it tends to want to fall open if the patient's going to fall open. And so that can lead to this, like this says here, dry mouth and things like that. So if we have a patient that already has a lot of dry mouth, or we feel like they're prone to being a mouth breather, we may want to make them something that has maybe ball clasp retention so we can really tighten that up on the teeth. And we may want to put some anterior hooks on the front of that I know I'm small, anterior hooks on that so we can hook those rubber bands. And they're just regular ortho rubber bands. It's not like you have to buy a bunch of other stuff. So we've all seen the way kids are with the rubber bands. It does not restrict them from opening. It just makes it a little more difficult. So at nighttime, when patients are relaxed, it will be enough to hold them closed. If it's not, throw a second rubber band on there. Usually that's plenty. So again, now if a 35-year-old guy comes in, maybe he's a little heavier set and he's mild or moderate, maybe I'm not going to talk to him about a Herbst appliance because while they are a hair less expensive, the one downside that we have with the Herbst appliance is that with the metal bar setup, they can be a little more cumbersome in the mouth. They can be a little less comfortable in the mouth. God bless our greatest generation, our seniors right now. They've been through a lot. They're usually a little more rough and tumble than some of us patsy 30s and 40s something. So, you see some of these guys and they're like, yeah, I don't care, just whatever the insurance covers, and they'll tolerate it. And they do tolerate it. This is an old Herbst appliance that I had. This actually goes in my mouth. I tolerated a Herbst for 3 or 4 years and did just fine with it. But as we move forward, we're going to talk about some that are slightly more comfortable. So that is that for Herbst.
Dr. Manning, I'm going to hop in here real quick.
Yeah, let's do it.
I know you are through the first one, but we got a couple of questions specifically to what you just talked about.
Okay.
Do you always start with rubber bands and the hooks, or only if you're not getting the results that you're looking for?
You know, usually with because with the Herbst, I'm doing it more and almost exclusively for my Medicare patients. The Medicare patients, I mean, I think we all have a picture of like grandpa or some uncle sitting in the easy chair, like, you know, his mouth's wide open. You know, I actually take and add anterior hooks to all of my Herbst appliances on the off chance that I need them. And then we talk about it with the patient, but we also get some sort of feedback as we titrate. You know, we'll talk about, is the mouth falling open? So we don't always use those, but you know, I put the ball clasps in there for rubber band retention. So if I need it, I've got it. I don't know. Does that answer that question?
Yeah, absolutely.
Awesome.
And then how much, or how do you determine when and how much vertical dimension to do for patients right when you're starting?
Yeah, and it's interesting. That's a good question. Vertical dimension seems to be the one thing that is sort of escaping a little bit, because you'll see some data one way and the other, where some people say the vertical has a ton to do with it, and some, you know, it's more about the anterior posterior. And I've found that, just without quoting any data, that the anterior posterior has a lot more to do with it, as long as we're within a certain range. You don't really ever want to go below maybe 3 millimeters of vertical. And a lot of times you don't want to go way above 5 millimeters of vertical. The problem is that when if you decide that you want to get a little bit more, if they've got a little more traumatic occlusion, or if you kind of want to open them up just a little bit so that they can get some of those cusps out of the way and create some room for that acrylic to be on the biting surface there, you know, you may want to go up to 5 millimeters. That's why you'll want to put the gauge in their mouth and then see, you know, if I put a 2 millimeter bite fork in on sort of a more traditional gauge, and you feel like there's not a lot of space between the cusps, then yeah, you may want to open it up a little bit more and open it up. The problem is that you better have, you know, a 2 or a 5 millimeter, up to a 5 millimeter bite fork on hand. Whereas with the SOM gauge, you can just kind of crank them up there until you get like a nice vertical. I've found that 4 to 5 millimeters of vertical works for just about everybody. I know there's some machineries out there that you can buy, and you can blow into things and check to see where you want vertical. And I've found that it's usually always around 3 to 5 millimeters. So I just kind of stick between 3 and 5 millimeters for most patients.
Awesome. Thank you. I'm going to get out of your way so you can keep plugging away, because we're
any other questions, for sure, jump in. Let's make sure we're answering questions as they're coming. So thanks, Michael. A couple of other SomnoMed appliances. Now, I wanted to start talking about this one. This is kind of the hallmark, sort of the flagship appliance from SomnoMed. This is their classic appliance. This is the one I started when I first started utilizing SomnoMed appliances. I started with the classic. When we look at this, you see, we sometimes will call these a dorsal appliance because of that dorsal fin. Some call it a wing and a block. The way these work is it's 2 independent pieces, so there's nothing really connecting these 2 together. We notice this arrow shows us how to adjust, and as we adjust, this block will actually push into this dorsal fin or this wing, and as it pushes that wing forward, it moves the lower jaw forward. So that is how those work. You notice this little part right here is where we make the adjustment. A little key goes in here, and if we want to move the lower jaw out, we'll move that key in the direction of the arrow. So on this side, we would move that up. Now, because of the way it works, the other side, the arrow will be pointing down, and as we screw that out, it will also. Now, the one thing about this is that these two move independently of each other. And the one thing that we always say as a cold, fast rule is whatever we do to one side, we have to do to the other side. So we just need to be very careful. You got to count these because you'll get the instructions from SomnoMed. It will tell you how much you will be moving this with each quarter turn. And you need to make sure you're doing each quarter turn correctly. You may do 8 quarter turns in one adjustment, but you need to make sure you're doing it the same on the other side. Now, a couple of things with the Classic that are great is that it's very comfortable. All of these parts are very smooth. There's no big metal bars on the side. One of the other things about the Classic, and this answers a question that hasn't been asked yet, is that these can sometimes be made for edentulous patients. You can make these to where instead of snapping on teeth, they go over their gums like a denture, top and bottom if you need. Now, the downside to that is that we need their mouth closed. So sometimes if we're using these for edentulous patients, occasionally in order to hold their mouth closed, we'll have to use like an external strap, like a neoprene strap that goes up and over. If you ever want to see some cool pictures of people using neoprene straps, go into Amazon and put snore strap or something like that. And we've had to do that with some of our patients that are edentulous, putting them into this. But this is the Classic, and I wanted to introduce the Classic first because the next two appliances, this bonus appliance, this Classic is actually not one of the 4 we wanted to talk about. We wanted to talk about the Herbst, and we got that out of the way. The reason why I bring the Classic in is because the next two that I want to talk about are sort of subsidiaries, or they work on this same concept, but they have a couple of things that are a little extra, or maybe not so extra, that may make them appropriate for some of your patients as we move forward. So versions of the Classic that we want to talk about now, our next appliance is going to be the SomnoMed Air. Now, the SomnoMed Air is a little bit more minimalistic. It's a little bit more bulky in its design. It doesn't quite have some of the streamlined features that the Classic has. However, it does titrate or adjust the same way. This arrow points up, the other arrow points down, the block moves forward, the wing moves forward, very much like the Classic. The upside for this, and you know, just as somebody that is in network with a lot of medical insurance, there are a couple of medical insurances that offer very low reimbursements. I don't love it. They love it. It just is what it is. We've chosen to be in network with some medical insurance providers, and so we're kind of at their mercy. And this is a nice ideal appliance because my cost on this is less. It's easier for these low reimbursement scenarios to where I'm not going to receive as much from their insurance. And so with this appliance, I'm not going to have to pay as much. Now, that being said, I'm not trying to be cheap with them. I offer them the ability to upgrade the appliance to something, you know, that I like a little bit better. But if they want the one that's sort of their in-network sort of formulary appliance at that cost, this is a great way to do that. We can always do, I don't know what we call it in dentistry, the upsell, the wheeler dealer, you know, when we want them to do something a little bit nicer than what they want to do. This one gives us the ability to do that. We can always move to some of these cooler appliances, but the Air is a nice affordable option that is a sort of take on the Classic or Hallmark appliance from SomnoMed. The other one that is the take on this, and this one's kind of cool. We'll talk about what makes this one cool. Again, another take on the Classic. We see in our picture, the arrow points down. That will help move this forward. But occasionally we'll get a patient that as we're trying to use these gauges, the SOM gauge, to set their jaw and find out where we want them to be, sometimes patients just have trouble really like getting in there and doing it the way we want them to. They're kind of all over the place, and we're not totally positive if we've got them too far forward or too far back. We just kind of got our bite set and we'll try it in. Almost all appliances that we've talked about so far, once you start at a certain spot, you really can't go backwards. You can't do the retrusion of the appliance. You can protrude them more, but you can't really retrude them from that initial starting position. And so if you started them too far out and it's not comfortable, you're really kind of remaking to get it to go back a little bit. Now, the next two appliances, the Fusion and the next one that we'll talk about, are the two that that is not always the case. We can make these small increments with this, but we can also go backwards 2 millimeters from the starting of, so if we did start them out too far and it's uncomfortable, this gives us the ability to go backwards a little bit more, but also allows us to go 7.5 millimeters forward. So that's a lot. So if we set them too far back and we need them to go forward, and you don't want to run out of room, run out of highway for this block to move forward. So it gives us a lot more ability in our range. We can go backwards, but we can also not only go forward, we can go a lot farther forward. Now, the other thing that I find to be really, really cool about this, and it speaks to a little bit about the way I got started in dental sleep medicine, although this wasn't around back then. I said that the very first guy I had owned a transportation company, and he had employed a lot of truck drivers, and these truck drivers had licenses, and these licenses were contingent on the fact that they do not have uncontrolled sleep apnea, because they don't want to have the liability of knowing that one of their drivers has sleep apnea and could potentially get into a wreck. So long story short, they started putting in CPAP machines, they started putting sort of like compliance indicators, like, are they really wearing this at night? Because they're okay to drive, because they're doing, they're technically, they have sleep apnea, but as long as they're using their CPAP, they're fine. So they really needed to make sure that the patients were using their CPAP. So in these CPAP machines, they started putting compliance indicator microchips in these CPAPs that at any point you could pull that data off if you had to provide compliance to an employer or the Department of Transportation or a licensing bureau to, they need the compliance report. The CPAP machines for a few years have had the ability to do this. Now with the Fusion, they have something called DentiTrack, where inside there's a pressure sensitive microchip that lets people know that they're using it, that it's in their mouth. And when it's in their mouth, they're doing good and they're not apneic when they're using it. And this allows for those people who need trackable identification that can show compliance. What a cool thing. Now we have this built into this particular appliance. So kind of a neat thing. You kind of scratch your head and think, well, geez, they thought of everything, which is one of the reasons why, and I'll get into it a little bit later, why I just have really kind of gone completely exclusive with SomnoMed, because they're sort of on the cutting edge. They're not a lab trying to make oral appliances and crowns. They are, they're a medical device manufacturer. They are in this for the patient medically. I mean, everything we've talked about here is all medical. So, and just one more thing, like, seriously thought of everything? Yeah, they have. So anyway, we'll skip on the video. Now, this is where I'm going to get a little bit excited, because these new school digital appliances, a lot of dentists are now moving to digital impressioning. And so SomnoMed has a digital impression appliance it's a milled appliance. It's called the Avant. And a lot of cool features about the Avant I want to talk about really quick. First of all, digitally designed, because we do all scanning impressions. We have an intraoral scanner. So we try to do as much scanned and milled as we can. The one thing about this Avant, and lest I be speaking out of school, I currently use the Avant, and I don't see myself changing from the Avant anytime soon. It has sort of become like my little, I don't know, what do you call it? What does Linus have? His little blanket. It's like his little whoopee. You're just never going to see me without this thing. It's very durable for as thin as it is. Now, that's the one nice thing about a milled appliance, is that you can mill it out of already super duper hard material versus some of the classic ways that we make acrylic in the mouth. Because it is milled, it's very thin, which makes it very comfortable. The other thing about it is that it has that same Biflex liner for patients, and this Biflex liner is very comfortable. It's sort of that soft, flexible interior, but fits very, very snugly against the teeth. Now, you'll notice of all of the things, this has kind of the most odd looking way to hold the lower jaw forward. Because it's milled, they can very precisely put this little groove for this sort of this band to go through right here. this allows for adjusting to be really easy. You just pop it off these two buttons, slide this band around to the white part, which is slightly thinner. Right now, this will not pop out. The precision of it will not let this pop out of this little groove that's here. So we slide it forward to the white part, which is thinner, and then it pops out. And then we can pop in the next one. You notice that this one's a 0, and the next one will be 1. And each time we want to move out that next increment, we just move to the next blue band. So our appliances come with a cart that has all of these blue bands on them. Now for us, this has become a game changer because we do some advertising here in Arizona on the radio, which means we get patients that are coming from all over the valley. Some are driving 45 minutes to an hour to get here, and which is fine, you know, but we want to be respectful of their time. This has been a game changer for us in this regard, especially with the telemedicine portion of it. And that is, I do not like to leave patients with a little key and have them poke it in and move these things 1/8 of a millimeter every single time and then try to remember what they did and hopefully they didn't screw it up. So I always bring patients back for titrations just so that we can monitor how well it's doing. With the Avant, this is a very simple way for patients to be able to titrate these at home, or we can jump on a call, telemedicine style, because they just move to the next one. They pop out that band, pop in the next band. We make sure it's comfortable. They sleep with it for a night. We follow back up, make sure they did okay with it. But they don't have to drive an hour for me to do a 5-minute little tinker with the side of their appliance. The other nice thing about this is that band is sort of designed to where your jaw can move in that banded circle without really doing anything to the jaw joint. The jaw joint has a lot of flexibility to go in any direction it wants except posterior, which is the direction that causes us the most trouble. So I thought I would just jump off of this really quick to show you that this is mine. I will be sleeping with this tonight. Ladies, don't be jealous. This one's coming to bed with me, but it's very, very comfortable. And you can still kind of talk with it. I get that little like retainer whistle. But I told Michael I wouldn't do it, but I'm going to. You can take a little sip of water with that if you need to, but very streamlined and very comfortable. It's not much for getting the ladies, but I have found this to be the most comfortable appliance that I've ever used. Easy in, easy out. But in essence, really, really thin and streamlined. You know, when you look at the width of the Avant and how streamlined it is without a lot, these are very comfortable and smooth versus, you know, and I'm not giving the Herbst a hard time. He's been a workhorse for a long time, but definitely a big difference in how they're able to streamline that down. So now let me jump back onto our slides here as we finish up. The thing we want most is that we want the patients to be able to be compliant with wearing this. When we think about the things that are going to keep patients from not treating sleep apnea, right away we say, well, if it's the CPAP, they're not going to do it because it's so difficult for them, and compliance with the CPAP is very low. And while compliance with an oral appliance is so much higher than it is with a CPAP, even within the oral appliance, we are still trying to achieve high patient compliance. And the way we're going to do that is with comfort. And for some patients, it's going to be just getting it in their mouth. So we need to make it affordable and being able to do that. Now, the one thing, and I mean, I don't want to speak way out of school. Obviously, we set our disclaimers before. One of the reasons why I'm here versus some other schmuck is because I've kind of gone exclusively to SomnoMed. Their appliances are extremely comfortable. They have a very smooth finish. They just do a good job because they're more than just a lab. They're a medical device manufacturer. And so they are looking at this through medical goggles. They're looking at this through patient compliance. They've got an offering of different appliances so that we can utilize different things for different patients. You know, when we, you know, Michael, if you want to jump to the next slide, you know, the one thing that we always, you know, want to do is try to look at this from the perspective of the patient and what needs does the patient have. and the patient just wants to stop hurting. They want to be better. They want to be better. And so the way that we get them better is by getting this in their mouth and have them utilize it. And the way to get it in their mouth and have them utilize it is to have it be comfortable and easy to use. So now that's kind of the appliances part of it. You know, and we talked a little bit about the need for this kind of stuff. It's kind of fun at the end to talk about a few other things. So this is going to conclude sort of the CE portion of it, where we're talking about those 4 appliances, but you may want to hang around because we're going to talk a little bit about some bottom line stuff and have some offerings that might help you kind of get through this jungle a little quicker.
Yeah. And Dr. Manning, we have, we had quite a few folks on tonight, so we do have quite a few questions.
Mm-hmm.
I want to get to a couple of those questions, specifically on the Avant. So you were talking about using the Avant quite a bit
Yes.
when you have the ability to financially. Can you do elastic hooks on that? Have you done the anterior hooks? I know you can.
Yes, you can, but I will say there is a, you know what? I'm doing it. I'm doing it. When the mouth wants to fall open, the band creates a tension that doesn't let it fall open very easily. So to have that sort of more cumbersome part of that, you know, that band tends to create some tension. So while you can use anterior hooks, and if you want to build those in, I am not building them into my Avants because we have not seen a lot of that happen because of that sort of that band tension doesn't let it pull forward. Mm-hmm. As it pulls forward, it like grabs those little buttons in the back and wants to hold it up, almost like a reverse lever kind of thing.
Got it.
So,
and you know, I apologize. I think we skipped one slide here. I'm going to go back one real quick. I know you were talking about the return on investment, the financial bottom line piece. And
right. Yep.
I know, you know, I know our webinar tonight is about the appliances that treat, you know, most of your patients. You know, if you could just real quickly, Dr. Manning, before we hit those Q&A, I apologize. I moved forward from this, but do you want to just kind of speak to your experience with this and what that looks like in your practice?
I think it shows a little bit of potential. And the thing about it is that we're going to try to bake everything into this cake. So when we look at our costs, one of the things that is great about oral appliance therapy as part of an addition to your practice is we call these a value add. This is not going to take so much time that you're going to end up having to value replace something like, well, I'm doing sleep, so I guess I'm never going to do implants again. This is something that takes so little of your time. As long as you can find some training that will get your team engaged in helping you with this. So much of this is team driven that really from start to finish, this should take only a half an hour of your time. If you are in a model where you are offering a home sleep test through your office, that might cost you $100 to administer that test and have it read by a physician. If your office has a CBCT, that wouldn't cost you anything to take a CBCT. And then the appliance on the very high end is a $600 appliance. Did I just lose something?
Yeah, we lost your video.
Okay. Am I back? Am I okay here? Let me see if I can start video again here. All right.
There we go. Gotcha.
So, when we're talking about this, we're all in at about $1,000, and that includes, I mean, that's trying to bake everything into the cake. You know, if we say that a half an hour of a doctor's time is $350, that puts us about $700 an hour. That's a pretty good dentist, you know. So all of that baked in, including if we're offering home sleep testing, you know, we're in at about $1,000. But if we come over to our payment, you know, we can bill, especially if we're doing medical billing and things like that. We can bill for the exam, like an initial exam for these patients at $100. We can bill for a home sleep test at $200 if we want. Maybe you don't want to do that. That's totally up to you. But, you know, if you want to bill for a CBCT, you can do that. And you can charge, you know, up to $3,500, maybe even more, depending on where you're at for an appliance. You know, that bottom line puts you at $4,000. You can kind of a la carte that as you want. You say like, oh, I don't charge for exams, or I'm not going to charge for a CBCT. Fine, that's great. Take off $350 off that. You're still, in that neighborhood of between $35,000 and $4,000, and you're only out $1,000. So you're looking at $2,500 to $3,000 in profit per one of these. So if you can identify some of these patients in your own practice, they're floating around. I promise. You saw the demographic. There's a ton of these patients in your practice that are hurting. They're just waiting for somebody to talk to them about it because they're not going to. You could really add anywhere from $7,000 to $25,000 to your bottom line every single month, and you're talking about so little time for you to do this in the office. So
now I'm going to add the official disclaimer here, guys. For those of you that are watching, this is not a guarantee of rates, and we are absolutely not saying this is what you should set your fees at. Those are going to be practice specific, but just as a general use and national averages across the country, this is what's on the slide here. So let's shift into the Q&A because we do have quite a few questions. Dr. Manning, which of the appliances, you said these 4 are going to fit the vast majority of patients. Which one are you more prone to use for bruxers? We've had, I think, 3 or 4 questions about that.
Yeah, bruxers is always going to be a hard thing. I really like a milled appliance for a bruxer, so the Avant is great. One of the reasons why, when we're talking about appliances and the way they're fabricated, we keep saying milled versus not milled. If we think back to dental school, if we're making something out of acrylic, we're going to mix the acrylic together. You're going to get your monomer. It's going to smell like cancer. And anyway, you're going to end up mixing it all together, and you're going to pack it around the teeth, and you're going to try to get your adaptation in there, and then you're going to grind it back. But you have to have a certain amount of thickness in that acrylic to make it viable against bruxing. So while I think all of these, except maybe the classics, those wing and let me not get off track. You're gonna have to have a certain thickness in order to get that to stand up to bruxing. So in some of these more traditional appliances that are made by mixing, your monomers and things like that together, they're going to be thick. If you're wanting to go against bruxing, you may open the vertical up to get a little more acrylic in there. Now, with something that's milled, they will actually take a block of material that's really nice and really hard and really solid already, that they can make a lot more solid than this acrylic, just in general on the old Mohs hardness scale. And they can make it thinner and more streamlined and comfortable, but yet get the same amount of compressive strength that the thicker traditional non-milled appliances. So I really love a milled appliance for bruxers. The only thing, if they're a really hard bruxer, that I would stay away from is the classic. The classics have those dorsal wings on there, and there's nothing worse than somebody coming in and having one of those broken off because they brux side to side and popped that thing off of there. Most other things can be repaired. That's a remake. So
gotcha. Cool. Another one is we've got a question about warranties on the appliances. 3 years on the Herps, the Fusion, and the Avant that have been mentioned tonight. I'm going to kind of summarize for time for everybody. There's a few questions about specific patients and scenarios that you guys have been in. If the patient's outside of that warranty, I'd still recommend that you contact your SomnoMed rep and see if they can work with you on some level about getting a replacement device or something like that. Maybe a discount off of a new appliance or something. But I'd recommend you guys reach out to them for those unique scenarios. If the patient's within that 3-year warranty, that's a fantastic option to basically get that appliance repaired, whether it's the discoloration or the soft liners doing stuff like what you guys have mentioned. Really well built appliances like Dr. Manning's mentioning, and they come with a warranty. So 3 years on all of those. Next question, Dr. Manning, when you're dealing with the edentulous patients, have you ever used an Avant, or can the Avant be used for an edentulous patient?
That's actually a good question, and I'm not totally positive I have the answer to that. I'm inclined to say no. I could be wrong, but the Avant is new enough that I have not had even the scenario come up to use it as a edentulous patient. But that's something I need to ask my rep, and that question may go to the rep. I don't believe that it's indicated right now for edentulous. The thing about the classic is that the pieces are independent. They're not hooked together in any way. And that is usually the way we handle the edentulous patient, is we don't necessarily want those pieces hooked together with whether it's a bar or a band or anything like that, because they're too easily pulled away from the other edentulous arch. So the nice thing about the classic is it's basically like two dentures that have things that make them work, but they're not physically connected.
Got it. Awesome. So if it's all right, I'm going to ask you, Dr. Manning, to stay on, but I do need to make an announcement for everybody since we are at the 6 o'clock hour. We do have the CE portion for tonight is concluded. We're going to continue with these questions, and we also have a couple of offers that we wanted to throw out to you guys. Dr. Manning had talked about using his own device, and Dr. Manning, I'm going to ask you a question about that here in a second. Sure. But SomnoMed, as a sponsor for tonight, is offering $100 off of your personal device. So if you can take a screenshot or a picture, this is your code right here, A2S Avant 100, to get $100 off your personal device. As far as our next webinar, if you guys liked what we were doing tonight, we're going to talk about case acceptance on the next one. So pencil it in on your calendars, February 9th, 2021. So in about a month from now, it's going to be the first Tuesday or the second Tuesday, pardon me, of next month. And we're going to talk about case acceptance and how to increase that. And the last thing is at Awaken to Sleep, we put on 2-day courses similar to tonight, but with a lot more interaction and some breakout groups. If you liked hanging out with Dr. Manning and myself tonight, if you're a glutton for punishment, there's more of us.
Much more, so much more of us.
So, you know, it's a 2-day virtual sleep course for you and 4 team members. Your $400 off code is SM400. The only thing with that, the only catch is that it's only good until Friday. We've got 6 courses scheduled across the next 6 months. So it's not something you have to do this month, but you've got to make a decision by Friday. And respectfully, if you are in the group that is trying to learn how to do this or implement it and work out some of the hiccups in your practice, you're not going to waste $200 on 14 CEs for yourself and your team if you want to bring them. So we'd highly recommend that. And yeah,
Michael, let me just quickly jump in
Sure.
there. Obviously, you know, you and I will both be on the Zoom call for that 2-day deep dive course that's really comprehensive. It's fantastic. You're never going to find anything like this at this price for your whole team. I say that because I've been to about every CE by about every different person or group out there. This is for a 2-day course. This is one of the more fantastic, well put together layouts you're ever going to find, and you're never going to find it like for less than $200. That for your whole team. Good night. So anyway, it sounds self-serving, but I've been to just too many to not be able to say that.
Thanks, man. Yeah. So I mean, like I said, let's get back to some of the questions. We did have quite a few more, so let me read a couple. Next one is, are these okay for people who've had major cosmetic work done? Like lots of veneers or, you know, Dr. Manning, I'll let you hop into that.
Yeah, and again, this is where SomnoMed's thought of everything. This new Biflex stuff that they have it was kind of the brainchild born out of wanting to be protective of porcelains and teeth and things like that. You know, it's an interesting material. When I first put it in, I was surprised at how tight it felt, but how comfortable it felt. And then when it's time to come out, how little it pulls on the teeth. You know, sometimes with these ball clasps for retention, you know, these ball clasps are constantly going over the top of an old PFM or potentially even some of the new disilicates and things like that. And you'll see ball clasps break teeth, plain and simple. You'll see them break ceramics, but the Biflex material, I mean, we're never out of the clear. Anytime something's going in and out of the mouth, you have the potential to you know, have a crown slide off or, you know, or something like that. But this new Biflex material has just been really great for that kind of stuff and so comfortable.
Gotcha. Cool. For the SOM gauge and any gauge, candidly, how do you do that with digital impressions? That's not something that we really covered tonight because we're more focused on the appliance side. But I know you do digital impressions in your office. So how do you do that?
When we're doing digital impressions, the nice thing about the SOM gauge is that you can do it similarly. A lot of times you'll just put, if you want to stabilize the posterior when they're biting into it, if you want to stabilize something, just put a little dot of blue bite on the back of there to help stabilize it. But maybe not have it completely cover the buccal side. There is a bite fork that can be used like this, where there is just a little bit of a smattering. I broke this other side off because I'm a big dumb animal, but this little thing, you can put a little bit of this on the back, a little blue bite on the back of there. And then when that bite forks in, you can scan and it will show that it's open, and it will give the amount of open, but also register that buccal bite. And then submit that just over the, whatever you submit to your lab, just choose SomnoMed as your lab, and you can submit it just digitally right there. Is that
cool?
Michael, as a non-dentist, did that make sense?
Sure.
Great.
You knocked off one of the tabs. I mean, having fun.
Yeah.
So how many different bars or bands come with the Avant?
Oh, gal, I need you to put me on the spot. I think it's 10. It might be 12. I should have grabbed a box of them. I mean, way more than you need. We'll just say that. It comes with way more than you need. Again, I'll hand it to them. There's, from where they start out at 0, there's, I think, 2 that you can go backwards if you've missed it to anterior.
Yeah.
And then way more. I think I'm on 3, and the other day my wife said that she thought she heard me snoring, so I moved to 4, and 4 was like way too much, and I think it goes all the way up to like 8 or something like that. So, and 4 was already like, I felt like my jaw was in the next county. So anyway.
Cool. Can you do, since the Avant is a milled appliance, digitally milled, can you do it without a digital impression?
Yeah, sure. Yeah, I mean, it's going to be the same as any other thing. Most patients, or I shouldn't say most, a lot of dentists don't know that their things are being done digitally when they send them analog anyway, because a lot of times they'll pour up stones, or they'll do like a 3D printed model based on things that you're sending over anyway. And so, yes, you can take analog impressions and still have an Avant made.
Got it. Cool. And then we've got a couple of questions about the codes and the links. So let me tell everybody that's still on, you're going to have an email sent out first thing tomorrow morning. The links to the offers, as well as registering for the next webinar, will be in that email. So check your inboxes. There will be a link and the discount code to order your personal SomnoMed appliance, a link to register for the next webinar, and for the upcoming course, if you guys want to take advantage of that before Friday. So you'll have all 3 of those sent out to you in your email. So check that tomorrow morning. What's the minimum vertical? One last question, Dr. Manning, and then we are going to wrap it up here.
Minimum vertical.
What's the minimum vertical for the Avant?
5 millimeters. I would say 5 millimeters is what you need. And look, I know if there's other appliances out there that are not made by SomnoMed. Anytime you're doing a digital impression and a digital appliance, 5 millimeters. Good rule of thumb.
Got it. All right. And for those of you guys that want to hit it a little bit quicker, we do have the links and the codes to both of the discount offerings in the chat as well. I just saw that. So thank you guys for sticking that in there. And thanks to everybody for hanging out with us tonight. Dr. Manning, you got any last words you want to leave us with wisdom from yourself?
Well, I never actually have any wisdom, so that's not going to happen. But just lastly, that, and I kid around, maybe a little self-deprecating, that if I can do it, anybody can do it, kind of thing. There's so much more truth to that than anybody would know. But it's been so much easier to see success in offices that jump on some of these things with their team and get their team engaged. I mean, for me, I'll go a whole week and see 20 sleep patients for titrations or new sleep patients. Some of them I don't even see. My team is just dialed in to where a lot of this kind of stuff. So if you're thinking about getting into some training, absolutely, it needs to be team driven. So that's where I feel like Awaken to Sleep and this little offering. Of course, anytime you get to spend more time on the web with this guy, it's going to be a good time. But parting words of wisdom, get some training with you and your team and make this so easy on yourself. This is going to be, I get it. This is a great time for us to get hugs and kisses from our patients. We're helping people, and we're actually, I know I don't want to overstate it, but we are truly saving lives. But at the same time, what a boon to your bottom line. There's just nothing like it out there where you can just make money helping people and making them happy.
Yep. And I would also add, you guys, don't go it alone. So whether you guys want to hop on a course like this, grab onto somebody who you already know is an expert in your backyard that you're going to lean on. If you're going to reach out and get a personal appliance, talk to your SomnoMed rep. I mean, these folks only do this for a living. So you got resources, and we're happy to be one for tonight. So thanks for tuning in, and we hope you enjoy the rest of your evening, guys.
Thanks, guys.
Have a good night.